Hello everyone, I'm Steve. I'm one of the OET trainers based in Australia. I'm going to assess one of my students' speaking role play conversations today and provide the feedback. The student is a pharmacist. We have already recorded the conversation, so let's get on to it now.
Hi, good morning. I'm Danielle, the pharmacist on duty today. How may I address you?
All right, so you have started it very well. I'm happy with that. Hello, Daniel. My name is Steve.
Thank you very much. Steve, how may I help you?
Well, I'm an 20-year-old, 28-year-old, businessman, and recently I have been feeling unwell with the flu-like symptoms. So I have come here to get the advice on quick fix medicines or kinds of tablets so that I can get back to my work.
Hmm, I know it's very unfortunate and I'm really sorry to hear that.
Hmm.
Mm,
It's good. So you were able to introduce your introduction section was excellent. You showed sympathy and empathy towards the patient. So it's a good thing. So the way you have used the phrases were really amazing. I'm very happy with that. Okay.
but before we discuss further, I would like to know more about your problems.
Yeah.
Are you okay with that?
Yeah, that's all right. Thank you.
Mm, From how much time are you feeling those symptoms?
Okay. So how much time? So this is wrong actually. How much time are you feeling those symptoms? So what you should have done is you should have used it this way. How long have you been suffering from these symptoms? Do you understand what I mean? So, how long have you been suffering from these symptoms? Or how long have you been experiencing these symptoms? Do you understand?
Yes.
All right. So, not, yeah, okay. That's the mistake. Let's go through the next one. Well, for the past, couple of days, I've been feeling unwell. All the night actually. I have got my sore throat, and I was also facing fever and headache as well at night. Actually, I'm a contractor with one of the multinational companies here in Australia, and I have got a contractual opportunity with them, and there's a lot of money involved in that, and it was a golden opportunity for me to get this contract, and I also would be able to get more opportunities in the future if I can perform very well. So I don't want to miss even one day of my work.
Okay. So, do you feel sore throat?
Yes, that's right. Yes.
Okay.
Actually, I
Are
just
you
would like to get
feel?
something like Panadin Fort, and that's yeah. I think that will be all. Please do not interrupt if the patient is sharing information regarding his or her concerns. Okay. Right. If I can get maybe some strong painkillers, I would be able to start working, and it shouldn't be an issue.
Okay. But see, it looked like that you are
It looked like, okay, let's say it looked like, that's wrong. It looks like. So it always goes with the verb plus yes. Okay. Remember that he, she, and it always goes with the verb plus yes in the present tense. In the present verb form, these things go only with the verb plus yes. You can't say it look like. It looks like. That's the correct way. All right.
not having enough rest, and is it so?
Well, see, as I already mentioned, I have got a contract, and sometimes I got to work for maybe 12 hours. It is my own business anyway, so I got to work longer. If I work longer, I would be able to earn more money, and I have got mortgage and other things as well. So, from personal and professional point of view, I would like to work every day. I don't want to miss even one day in a week.
Yes, I understand nature of your work, but unfortunately, I will not be able to help you out in this, uh, as I can't diagnose
Mm.
properly, and I can't give you the medicine.
Okay, try not to give long pauses in between. Okay, please do not give long pauses between two words. For example, let's say you have said this, I cannot give this, and then there is a pause. Okay, medicine. So this is not good. You should avoid this. Okay, sorry. So that should be avoided. Okay, let's go to the next one. Mhm.
As it is prohibited, strictly prohibited, and it is illegal.
As it is prohibited and strictly prohibited. It's like my name is Bond, James Bond. All right. So what you could have done is it is prohibited, strictly prohibited. Okay. You could have used maybe one phrase. That's all right. It is prohibited is okay, or it is strictly prohibited. Use either prohibited or strictly prohibited. But the words are good. The way you use these words are okay. But you shouldn't give false starts. Okay, the false starts need to be avoided. Sorry, need to be avoided. That is an issue. All right. Apart from that, it is okay.
So I can't take risk. Actually,
Oh.
I'm really sorry for the inconvenience caused by it, but you should take any other medicines, and if you take a lot of fluids and steam, it's gonna help you a lot in this way.
Okay, it's gonna help you a lot. Okay, you shouldn't use these
Going
kinds of informal words. Okay, it's gonna help. You have to say it is going to help. Again, the next sentence you have said it going to help. That is also wrong. I will play that. Okay, I have noticed this, but I was not able to tell you during the conversation, right? Okay, but see, I have to go to work today, and it's I have got a lot of pain yesterday as well. I got a headache, and I was sick all the night yesterday. So I just wanted to, get maybe something that can help me out to get relieved as soon as possible.
Yes, yeah, I can give you a painkiller like ibuprofen or paracetamol, but
Mm,
I can't give you the Panadol food as it contains codeine, which is
mm,
30 milligram per tablet. So we
mhm.
are strictly not allowed to give without a prescription.
Okay.
So I can't take risk for me as well as for you.
Okay, I understand that. For me as well as for you. You can say for me as well as you. I mean, it is just a recommendation only. It's not a for me as well as for you. Okay, so you could have mentioned for both of us. Okay, that's a good thing. Okay, for me and you. Otherwise, Okay, are there any other
I
medications that can help me out to get relieved from this pain?
Yes, I can help you regarding cold and flu relief
Okay.
medicines, which
Yeah.
are very easily available over the counter
Oh, sounds good.
medicines.
Thank you.
Yes, so I can
Mm,
give you that, and you can apply those. You can have
mm,
nasal decongestant,
okay.
which going to be
Yeah,
help.
I told you, right? Which gonna and then which going to. So both of them. Okay, let's say which gonna and then which going to. So both of them are incorrect. You have to say which is going to. Okay. And the other thing is no false starts, please. Okay.
You a lot.
Okay, that sounds good. So does that mean I can take this tablets and I can go to work and continue my working today?
Yes, you can easily continue the work, and if you will take rest and you will have high fluids, then you can.
Highly fluids and then high fluids. Okay, highly fluids and then high fluids. You could have used maybe this one, a lot of fluids. If you have take lot of if you take a lot of fluids, it's going to help. Otherwise you can say if you can take more fluids, okay, that is also good. Otherwise if you can take what you can say, sufficient, or you can say you have to take more fluids, or a lot of fluids, sufficient fluids, that could have been much better as well. All right.
mm, feel better.
Okay, all right. Yeah, no worries. Yeah, I think that would be all right. Thank you.
Yeah, to summarize, we have discussed that I can't.
To summarize, we have discussed, okay, let's say to summarize, we have discussed, and then there is a longer pause after that. A longer pause was placed here. It's not good. So what you should have done is you should have said, to summarize, we have discussed blah blah blah. Okay, so you shouldn't give a pause after we have discussed. You should give a pause after to summarize. Okay, do you understand what I mean?
Yes,
Okay, good. Let's go to the next one.
prescribe you, or I can't allow, I can't give you the prescription you are.
I can't allow, or I can't give you prescription. I don't know why you have used both of them together. I can't give you, or I can't allow. I think it's the other way around. Sorry. So it's like I can't allow, I can't give you false starts. You have to use only one. False starts need to be. You should have said I can't give you. Unfortunately, I cannot give you. It's better to use, formal words. The polite words. I couldn't, instead of saying I cannot. Okay, it's much better to use I couldn't. Okay, do you understand what I mean? It's going to be more
Yes,
polite. It's going to be more formal. Otherwise, sometimes the patient may be arrogant or angry about you, and he or she may abuse you as well. Do you know what I mean? So it's better
yeah.
to use these kinds of. So please understand that I couldn't provide you any medicines. So use these kinds of phrases so that you can politely convey the information. Okay.
Classic Benedict Fort. I have told you about the side effects of that.
Mhm.
So, and now you have agreed to buy the over-the-counter medicine. Then you will try them.
Then you're gonna again. Then you're gonna, and then you will try them. Then you will try them. Okay. So please avoid these ones. You gonna. Then you agreed that you will try this. That's fine. That's it. Stop it there itself. Okay, don't say gonna over there. I think it is, you have been used to it maybe for a long time. I think that could be one of the reasons why you couldn't stop using that. Okay, but that's all right. We'll go through that definitely. Yeah, that's right.
So, do you have any other questions?
No, I don't have any other questions at the moment. Thank you.
Okay, if you have any concerns, please don't hesitate to contact the number which I have given you.
Yeah. All right, that's good. That's good. The way you summarized, the way you have summarized the whole conversation was good. I'm very happy with that. Okay. Let's go through the assessment factor now. All right. One is grammar is not up to the mark. Okay. You have to improve your grammar, particularly use of nouns, verbs, prepositions could have been better. Okay. Could have been a little bit better. All right. Use of false starts need to be avoided. The use of false starts needs to be avoided at any cost or reduced. Okay, but you have reduced a lot when compared with that of your previous speaking test. Okay, I'm very happy with that. The way you go through that is really good. Okay, try not to use try not to use more informal phrases. Okay, for example, gonna, all right, gotta, and so on. So it's not good. Can you? So don't use that. Please try to use I would like to, or could you please? I couldn't give you this. Sorry about that. So you need to say connectivity could have been better. You could have used some connecting phrases like, firstly, I cannot give you these medications because of two reasons. Firstly, these medicines are not allowed without any prescription. Secondly, as you have got flu like symptoms, you need to first of all go through the consultation with the doctor, and then only I would be able to give you the medicine, something like that. So you could have done that. Connectivity could have been better, but you didn't use connectivity at all in your whole conversation. That could have been much better. Okay, right. Your pronunciation could have been better by not giving background noises, and sorry, giving not background noises and unnecessary pauses between two words. Okay, you have given long pauses, between two words. That could have been much better. But you were able to get the information from the patient very well. So I'm happy with it. You're able to get the information from the patient and shared the information correctly. So that's good. I'm happy with that. All right. Connectivity, pronunciation, vocabulary, grammar. Okay. Use a range of sentence structures such as simple, complex, and compound in your speaking. You could have used that. Okay. But apart from that, I think there's no other issue. Try to use the adverbs properly. Like, it's not highly fluids, high fluids. Okay, for me as well as for you, it looks like you showed sympathy. Yeah, that's a good thing. I'm very happy with that. Yeah. So apart from that, I think it's all good. Expected score, to me this sounds like. Let me see the severity and the number of mistakes you have committed. So this one is one third. Okay, we shouldn't interrupt. Okay, some of the verbs, misuse of verbs and nouns, that's not good. Do not give long pauses. Do not give false starts. I think false starts and vocabulary, are the two major issues. Okay, and then the grammar to some extent. Okay, they are the three different things that you have to focus on. But this one sounds to be at least a C plus graded role play conversation. Okay, sorry, not letter, but the conversation. Okay, so I'm very happy with the way that you have summarized, that you have shown the sympathy and everything. And yeah, I wish you good luck with your next speaking practice. You must be able to get 350 easily, if you can rectify at least some of these mistakes. Okay. Are you
Okay.
are you happy with my assessment, Danya?
Yes.
Okay, good.
Yes.
All right. Thank you so much for your time. I really appreciate it. I will share with you the audio and this assessment through your email address. Thank you.